Hi guys. So this is going to be skill 1.29, assessing the abdomen, okay? First of all, you're going to gather your equipment and perform wipes. So what equipment do you need? Well, you definitely need a stethoscope, right? And then you would need gloves if this abdomen had any skin issues that you wouldn't want to be in contact with. You would have to have gloves on, okay? So stethoscope and gloves. You would inquire about your client's history. So you'd look up his history. What are you worried about? You're worried about things that interfere with the stomach, with the gut, okay? Incidences of abdominal pain and associated symptoms. What are the bowel habits of this patient? Incidence is of constipation or diarrhea. Do they have IBS, irritable bowel syndrome? Don't know what it is? Look it up. Google it. Change in appetite, food intolerances, and foods ingested in the last 24 hours. It's going to play a big part, you know. If somebody ate broccoli causes a lot of gas. So if somebody ate broccoli, you're more apt to hear a whole lot of stuff going on, okay? Whether they've had blood or mucus in their stools. If they've had any previous problems and treatments, okay? So that's all kind of the history that you want to find out about your patient. So then after we've done all that, and we want to assist the client into a supine position. Supine means on the spine, right? Remember spine, supine. So he's going to be laying flat on his back, and his arms are going to be at his side. You want to expose the abdomen from the chest to the pubis. Okay, you want to be able to visualize this whole area here, okay? So what we're going to do first is inspect the abdomen for skin integrity. Any issues, put gloves on. If not, don't worry about it, okay? Then we're going to inspect the abdomen for contour and symmetry. Are there any lumps, bumps that aren't supposed to be there? Does it look even? Okay, people with hernias might have a big bulge. Okay, and you've heard of an umbilical hernia, so that would be a big bulge right here at the belly button. Is your belly button in or out? Okay, these are all things we want to be looking at when we're inspecting the abdomen for contour and symmetry. The next, we're going to auscultate the abdomen for bowel sounds. Auscultate means to listen, right? So we're going to put our stethoscope in our ears, and we're going to auscultate the 4 quadrants, okay? 1, 2, 3, 4. How long are we going to auscultate? Well, we're going to auscultate each section until we hear something, or 1 minute, okay? At 1 minute, basically, there are no bowel sounds, okay? So you're going to auscultate. Are there bowel signs? Are there not bowel sounds? Are they hyperactive, meaning the minute you put your stethoscope on there, you can hear it? Or are they hypoactive? It takes about, a half a minute, 20, maybe 10, no, probably 20 or 30 seconds or it would be like a hypoactive, okay? Absent would be you don't hear anything, okay? And audible is you don't even have to put your stethoscope on that region and you can hear it, okay? So that would be audible. So you're going to be doing the 4 quadrants, right? 4 quadrants. The right upper, left lower, right lower. Okay? Got that? All right. The next is percuss. We're going to percuss several areas in each of the 4 quadrants to determine presence of tympany and dullness. So is there air in there? Is there fluid in there? And how do we do that? Well, we're going to put a couple fingers in each area and we're just going to tap. And we're going to listen for that. Did you hear that? So you're going to listen for different sounds. This is hollow underneath, so there's going to be different sounds. But the more you do this with patients and people, the more you'll get used to that, okay? So you're going to percuss. The next we're going to do is we're going to palpate all 4 quadrants. What are we palpating for? What does palpate mean? Palpate means to push, okay? So we're going to assess for pain as well when we're palpating. So we're going to do the systematically explore all 4 quadrants. So if you auscultate with the right upper, left lower, right lower, if you do it the same way, you're always doing it the same way. So what we're going to start off doing is we're going to palpate the right upper. Now, when I say palpate, I don't mean to immediately go like this, okay? You do not want to immediately push as hard as you can in that area. What you want to do is you want to give a slight little push, okay? And see if there's any tenderness, okay? Tenderness. If there's tenderness, then we don't really want to palpate harder because that'll cause really bad pain, okay? So if they say it's okay, that they didn't have any tenderness, you can go back to that area and push a little bit harder and see if there's, any issues, okay? Did you feel any lumps or bumps that shouldn't be there, okay? Did it cause them pain in any of those quadrants? When you pushed above the pubis, you may feel the bladder, so you got to be careful that you don't make them pee, okay? And then what we would do is we would cover up our patients, okay? Cover them right up. We'd put their blankets back up, side rails up or down depending on your facility policy. We would put the bed back down into the low position. We would assess that they had their call bell. We would make sure that they didn't need anything else for us in the room. We would wash our hands, and then we would go and document all of our findings. So that is skill number 1.29, assessing the abdomen.